bread, and forgive us our debts as we forgive our debtors, and lead us not into temptation, but deliver us from evil. For thine is the kingdom and the power and the glory forever. Amen.
Please be seated. Man, such talent, such a wonderful voice. I had a chance to hear Miss Brady warm up this morning. I was like, man, I think I'm hearing something. I thought maybe I was going to heaven. I was like, oh, today's the day. Must have done something right. So again, at this time, we want to thank everybody again for being able to come in. As you guys are slowly making your way in, please, we have seats. We have some in the front, some on the side. So please, as you come in, make yourself at home. At this time, we would like to acknowledge a few of our very special folks. At this time, I would like to invite the 47th Chief of the Choctaw Nation of Oklahoma, the third largest tribe in the United States. Ladies and gentlemen, Chief Gary Batten.
Well, halito, and welcome to the Choctaw Nation of Oklahoma. We're honored to have you here with us, and also to come here to our casinos and resorts, and where everybody's a winner at Choctaw Casino. So if you don't win, just feel good about it, that all your dollars are going to public health initiatives. So we do appreciate you being here. And a lot of our dollars do go to public health initiatives, but I understand that this is the Tribal Public Health Conference, and that we have people from Alaska. We have anybody from Alaska? Yes, right here. And we have people from Arizona as well. And then we even have from Minnesota. Is that correct? I see some at the back. And then my understanding, and also from some of the agencies from DC, our Office of Minority Health, we have some people in different things. So my point is, it's glad to see all of you come back here. It's glad to see everybody pulling together. And I think about since 2020 when we had COVID, that I think more than ever people are starting to realize public health is important. And I don't know how many of you are aware, but I served as our executive director over our health system from 1997 until 2007, until I became assistant chief. But public health has always had a place in my heart. And one of the things that I believe that's really important now is, for years, we as tribes, what have we done? We've done a lot of treatment. But I don't know that we've been able to we're getting better about getting into the prevention and intervention, but we need to stay focused on the prevention side of things. I had a young lady, a tribal member, the other day. She had met with me, and she was from Dartmouth. And she asked me the question. She said, since the growth of the Choctaw Nation and the tribes, and there's been more dollars available for public health, have we increased our mortality rates for our tribal members? And we have increased those mortality rates. I don't know about you all, but of course I go back to 97, and used to we had amputations like crazy due to diabetes. Now amputations in our area, you don't hear of that a whole lot. But we are doing a lot of intervention, but now our goal is to really focus on the prevention side of the things. And of course now, and I don't want to go into a whole lot of this, but since the McGirt ruling and a lot of you other tribes, we need to embrace our sovereignty. We need to make sure and step up, and we need to look at all the things that we can do from the environmental perspective, from all the community perspective, all those things we need to pull together. And I just appreciate you all coming together to collaborate to see what we can do to better the lives of our tribal members. And so that's the reason why I'm honored to be here today. I hope you have a very successful conference this week. And I know I was talking, a matter of fact, before I forget, I know I saw Madam President here earlier, but is there any other tribal leaders here? Madam President, I know I see you over there. Do we have any other tribal leaders right here? If you would stand, and let's give them a big round of applause for their leadership and promotion of health. And I know how many of you are staying in the Sky Tower this time? So your distance from there to here, that's a part of our public health initiative. So it's part of your wellness program. So it's a little bit of a jaunt, isn't it, to get over here to the Grand Theater. But we do truly hope that you enjoy your stay and wish you all the best. Thank you, and God bless you.
All right. And of course, Chief Batten, again, thank you so much for all of your continued support across all of our native country. As he mentioned, prior to taking office, Chief Batten served as the Executive Director of Health, where he oversaw the construction of the first tribally funded health facility in the U.S. Chief Batten is involved in the growth of the entire Choctaw Nation and continuously looks for ways to develop programs and services that will benefit all of the tribal citizens. So again, Chief Batten, thank you so much. All right. Up next, I would like to introduce our fearless leader, Miss Marty Walford. Marty Walford is under the Secretary of Support for the Chickasaw Nation Department of Health and the chair of the Southern Plains Tribal Health Board, the Southern Plains Tribal Health Board Board of Directors. So ladies and gentlemen, Marty Walford.
Good morning. How about that crowd? There's a whole lot more people up here than from where I was sitting at the table. I was sitting there thinking, man, people are still getting coffee. They're coming down from their rooms. We may have to go get some of them. And then I come up here, I'm like, okay, well, almost all the tables are full, so that's awesome. Thank you for being here this morning. It's time to wake up, everybody. All right, if you'll bear with me just a moment. I don't know about you, but I am so glad to be here with you in person. Never thought that we would be actually saying that. We're grateful for that, right? But what we've been through the last 2.5, 3 years, we're now very grateful to be in person, because if there's one thing that I've learned, and I figure some of you as well, is that I don't want to be apart. I want to be together. That was a huge thing that came out of, yeah, agreed. I completely agree. All right, well, I can't wait to get to our keynote, so here we go. Welcome to the 15th Annual Tribal Public Health Conference, a 7th generation of Southern Plains Tribal Health Board collaboration. I am Marty Walford, Undersecretary of Support and Programs for the Chickasaw Nation Department of Health. I'm also currently serving, as Wes said, chair of our board of directors of the Southern Plains Tribal Health Board. On behalf of the board, welcome to our event. Interestingly, we're one of the last organizations to be hosting an in-person conference, and we're so glad to be here with you. I hope you're as excited for the conference as I am. 3 days of conference, 52 sessions, 94 invited speakers, and our first mini powwow hosted Wednesday evening. And tonight, a special screening of Smoke Signals to celebrate the 25th anniversary release of the movie. Who's excited about that? Our Southern Plains Tribal Health Board staff has been working really hard preparing for the event, hoping and praying it meets everyone's satisfaction. We have a variety of tracks to meet the interests of our public health and tribal healthcare workforce. Our conference is your conference, and your attendance means that you share our vision for a happier and healthier Indian country. We recognize that working together makes our impact stronger, our reach more expansive, and our voices reverberate even louder. Our theme this year, Restoring Health and Uniting Community, is fitting. Over the past 2.5, 3 years, all of us have experienced the pandemic together. Again, we want to leave the pandemic in the past. However, we know we're going to have to deal with the ripple effects of the future. And I think just experiencing being in this great big room with you today, it reminds me of what we've been without the last few years. We come together and hope to exchange smiles, laughter, and stories that will carry joys we have so longed for the last few years. I'd like to also take a moment to recognize a few more board members that are here in the audience. If you're a member of the Southern Plains Tribal Health Board of Directors, please stand and be recognized. I know there are some here. Thanks, guys. Appreciate everyone being here. On behalf of the Board of Directors, we personally welcome you to the 2023 Tribal Public Health Conference and hope you have a great time here. Please reach out to any of our board, our staff, if you need any assistance during the next few days. Thank you.
All right, once again, let's give a round of applause for Chief Batten and for our chair, Miss Marty Wofford. All right, so I have a couple of announcements from our committee. So if you can bear with me very quickly, I will try to get through these so we can get to our keynote. As we know, this is our first year back. So again, it's so nice to be in person. In the past, whenever we did this, last year, whenever we went virtual, it was a camera, myself, and 2 people looking the other way. So it's nice to see some faces, see some brand new T-shirts, see some beaded earrings. It's so great to see everybody here. So this year, we know as we move forward, sometimes being in a large room, maybe we can get overstimulated, maybe we can begin to feel overwhelmed. Those things happen. Well, here at the Southern Plains Tribal Health Board Tribal Public Health Conference, we have a wellness area. The wellness area is actually located once you come up the stairs, and whenever you see registration, when you see all of our great folks up front, it's going to be to the left. We have 2 rooms available. We have the Willow Room and the Pecan Room. So our first room will be a dark, quiet room with chairs, some cool beanbag chairs. So if you just need a second to calm down, maybe get ready for your presentation, maybe get ready for some of those meetings, that would be a great place for that. In addition to that, next to that, we have our Pecan Room, which is going to be filled with some small activities, some small sensory toys, some other items to help us stay in that right mental space. So again, please feel free to use those throughout our whole conference. In addition to that, we have a lactation room that will be available on the 3rd floor on the south side. It's actually going to be over here. I was told by the committee that they wanted me to use my lips when I was pointing, but I have these big lips. I'll be pointing way across. We'll be pointing way towards Dallas. So I'm not going to use my lips, but it's going to be up here. So if you guys do need that, please let us know. We will have those things there. If you need any help finding some of these areas, or if you have any other questions, please feel free to reach out to any of our staff. All of our staff will be wearing their badges, and there's a very unique red line on the bottom. So if you have any questions, please, you can see it right here. Please find one of us, and we would be more than happy to be able to help you out. Or you can check in at our registration table. In addition to that, I want to talk a little bit about our evaluation. So of course, we're always working to be able to provide the best possible experience for everyone. So we have our overall evaluation, which will be available on the 2nd day after registration. Once you complete those, we have a limited supply of cookbooks for those folks that are able to get those things taken care of. In addition to that, we have a small gift from Sequoia, proudly indigenous. So in order to get those gifts, you will complete your evaluation and return those to the registration or the hospitality team. And again, those things will be available on day 2. So we're encouraging everyone to take some time and be able to complete those things because we want some of your feedback. Again, we want to make sure we're providing the best possible conference for all of our folks. In addition to that, I was asked to provide a brief reminder that during our lunch break, please take some time and check out some of our great restaurants here. I had a chance to check out some of our stuff. Yesterday, we went to Smashburger. It was on point. I recommend the double bacon cheeseburger with cheddar. It was on point. It was amazing. So please take some time, and this will be a perfect opportunity for us to go, maybe meet some of our staff, maybe be able to enjoy some of our folks that maybe we don't get to see in person. In addition to that, we will have snacks during the breakfast and the afternoon session. I am a snacker, so do I have any other snackers in here? Snacking, I like it. Perfect. So we're going to have snacks in the morning, snacks in the afternoon. So please be on the lookout for those. We will have those things set out. All right. Whenever you came in here, you should have received a door prize ticket. So every day, towards the middle of our keynote, the middle part of our morning session, we will be giving out some amazing prizes. So I have a little bit of clarification. So the tickets that you're finding right now, don't worry about it. If it's at the very bottom of your purse, or if you put it in your pocket, you can't find them, because you don't need them just yet. But those will be for a raffle later this morning. Those tickets are only good for today. When you come back tomorrow, we will provide you new tickets, and the same thing for day 3. So just please make sure you have those, and we will be able to provide that. All right. In addition to this, again, we want to thank everybody for being able to attend our conference. You should have gotten an email from Blake or some of our other staff, and you probably got some instructions for the Whova app. Is there anyone here that has the Whova app on your phone? All right, so you can see that. I see some people having it pulled up. So one of the great things about the Whova app, and as you can see over here, you can be able to see all of the things that are going on. You can see some of the stuff that we have going on today, and you'll be able to learn some things on this. In addition to this, you can scroll down and you can learn a little bit about some of our other presenters. You can keep up with some of our other staff and some of your other colleagues. I had a chance to kind of check it out this morning, and we have a lot of great side conversations. And shout out to Ambria Marshall. I think that we have a 3, maybe 4-year-long conversation that we just continue, through this. So again, it's such a great way for us to be able to stay involved. In addition to that, at the end of our keynote and at the end of our Indigenous Chef Series, we will have a brief Q&A. So the way that we're going to do this is, as long as you have it downloaded on your phone, if you can go to that portion on the agenda, there's a space on there where you can ask a question, and you can ask those questions, and we will be using those questions during that Q&A, during that live Q&A. So if you have any questions, feel free to jot those down in there, and we will try our best to get through as many of those as we can. And again, that's not only for today, that's also for tomorrow and for day 3. So please, if you have any questions, that'll be a perfect place for us to be able to get those things in there. In addition to that, we here at the Tribal Public Health Conference, we are working very hard to make sure that we can accommodate everybody and provide that best experience. As we know, some things do change. So if there are any changes to any of our events, they will be updated on the Whova app. So again, that'll be a great place for you to be able to stay engaged on that. All right. So I think up next, we want to introduce our keynote speaker. All right. So Dr. Evan Adams is a Coast Salish actor and a physician from the Kla'amin First Nation near Powell River, BC, Canada. Evan completed his medical doctorate from the University of Calgary, a residence of the Aboriginal Family Practice Program at St. Paul in Vancouver, BC. Dr. Adams has a master's in public health from Johns Hopkins University in Baltimore, Maryland. He was also the first ever Aboriginal health physician advisor in the Office of Providence Healthcare, BC Ministry of Health. Dr. Adams is currently serving as an exchange for the First Nations and Inuit Health Branch in the Indigenous Services of Canada as the Deputy Chief Medical Officer of Public Health. So ladies and gentlemen, please help me with Dr. Evan Adams.
Just quit. Hi, everyone. Oh my gosh, isn't this wonderful to gather? I just can't believe it. It's been really a long 3 years of us not being around each other and just dealing with COVID. And I think Indigenous public health, or the work, our work, all of our work of looking after each other and looking after our communities has really changed. So I was really pleased to be invited here to share some ideas, because I feel quite lucky in that for the last 25 years or so, that's been my work, is to help look after our people, our families, individual patients and clients, maybe in a slightly different way than some of you, because public health and looking after our people involves a number of workers. But I still think that our work is the same, which is to take care of each other, to take care of those most vulnerable in very painful situations, because often our clients are going through a hard time when we meet them, but also because of the circumstances around us, the situations that we work in. So, let me begin in a proper way. Aje chep otams je aje, I mut tathquanape, I mut tathqual, Cheche hatenapisht, Klesla atnan. My name is Dr. Evan Adams. And thank you to all of you, and thank you particularly to Tracy Prather, to Lexi Hill. Thank you to Marty and to Chief Batten and the Choctaw Nation. What a beautiful territory. It really is an honor to share some ideas with you to start off this week. If we could go to the first slide, that would be great. I think someone's running the slide deck for me. I don't seem to have a clicker up here. If that's okay. I've called my presentation today, Taking Care of Home in Difficult Times. I know the topic du jour is public health, but I really think we need to take apart some of those colonial ideas and put them in ways that we've always done things. We've always done public health. We've always looked after each other. We've always had an eye on the people and supported our families and our nations, and very much so for the last 3 years. And the subtitle of my talk is A Perspective on Caring for Our Children, Families, Elders, and Communities. My name is Tlesla Evan Adams, and I was an actor. I did this movie called Smoke Signals 25 years ago. Hey, Victor, I'm sorry about your dad. I really had a wonderful time making that film. I had been a professional actor for about 12 years before I was approached to do Smoke Signals. Actually, I approached them, and they were so happy to meet me because they had hired 2 actors to play Thomas and fired them. It was a really difficult role, very wordy character, long pages of dialogue, or really monologues to memorize. And I had been an actor for, I had become an actor to avoid my responsibility. And I know you're gonna get this. When you're young and Indigenous, you're told you have to get an education and help the people. And as a teenager, that just sounded so dreary and painful. And so when I was a biochemistry student in the city of Montreal, I was attending McGill University, I was walking down the street, and a casting agent came out on the street, and she said, "Are you an actor?" And I just lied. I don't know why. I said, "Yes." And she said, "Come and audition for me tomorrow." And I got kind of the second lead in a film. I was 18, and I was happy to leave behind the hard work of university life. It's kind of well, you've all been there. It's very painful. I really felt like I could die in the classroom, and then everyone else would just step over my body, and nobody would care if I lived or died. And acting seemed really fun to me. And I quite fell in love with the whole process. I went to theater school. I was lucky enough to find probably the only native theater school in the entire country. And they had a 15-month program. I really loved just the simple things that I was learning as an actor. But it was a kind of avoidance. And as I reached about 30 years old, I thought my original dream, which was to help the people, to be a helper. I mean, what's more traditional than being a helper? I thought, I'm getting too old to be a medical student. I have to do it now, or forget about it. Forget about it. And so I applied to medical school, and at the same time, I was doing this movie, Smoke Signals, and I knew Thomas was an old soul. I knew that he was like the elders I used to know. They were so good that they would die for you. And that's what I wanted to portray, that kind of old soul. Really, Thomas was an old woman in my mind. An old woman so beautiful that she would die for you. And I would literally pray that I could capture the beauty of those elders I used to know. And so that I could leave that behind. Even though I thought only 12 people would ever see Smoke Signals, I really wanted to capture that. So that's what I was doing in the movie, and I hear it's playing tonight. I won't be here, I'm sorry, I need to go home. So we were just doing this movie, and it came out at the same time I started medical school. People were saying to me, what are you doing going to medical school now? Your life's going to change with this movie coming out. And I knew my life wasn't going to change that much in that I didn't think Hollywood was interested in our realities. It was interested in a vague idea of who we were, but it wasn't that interested in the truth, the complicated truth of who we were. And so I stayed in school. And it was very funny because the movie was playing in lots of places. I was hearing about premieres literally all over the world, and I was hearing the reviews were amazing, but I had my nose in a book. And I didn't really realize that people were seeing the movie until one day I was on my obs-gynae rotation, and I was called into this case of an arrested labor, or really a prolonged labor. And these take place in the OR in case this pregnant woman having a prolonged labor needed a C-section. And I showed up, and there was an Indian woman, mid-labor. She came up to me many months later. I didn't recognize her. A woman mid-labor looks completely different than she does in real life. And she said, do you remember that day? Do you remember that day? And I said, I didn't. And she said, I was pushing, I was swearing, it hurt so much. And then I opened my eyes, and it was like a dream. There was Thomas Builds the Fire standing between my legs. And ever since then, I seriously have been way more known for having done movies than I ever was for being an indigenous physician working for, well, actually, they go hand in hand, and I'm happy to be remembered for playing Thomas. There are worse things to be remembered for, that's for sure. And I like that it gives us a place to jump off from. But really, my main job is to look after the people. Just like you, looking after the people, it's very complex. I sleep at night knowing that I've done my best. I feel troubled by some of the suffering that I see, but I know that I'm trying to do my part. And it's been really a difficult 3 years. I feel like I've sacrificed my own happiness, my own physical health, my mental peace of mind to try and help. And I know many of you feel exactly the same way, but it's a new day. And I really want to be a part of cheering you on to get to the next step. And I've definitely been doing my own part, my inner work, and being Indigenous has helped me with that, and I want to share what some of those ideas are. So I see the PowerPoint is still not up yet for you having to look at. Actually, I'm probably just as small on that screen as I am in real life. But I chose this photo that I wanted to put up there, and it's really just a photo of a group of children's shoes all lined up. And to me, it was a representation of our work in Indigenous public health. I chose that picture because they're clearly children's shoes. They're children's shoes all pointing in the same direction, which to me spoke to our future. It spoke to me about our way of being together, our way of remembering and supporting each other. It reminds me of our colonial past, of our colonial inheritance. And I was hoping that the picture would inspire you as well to think more broadly and clearly about Indigenous public health and looking after the people. I also wanted to share some personal stories because I think it's important for us to self-examine, to look at yourself and to see where you're working from. We have very different lives. Thanks, if you could go to the fourth slide, or maybe to the third slide. I just want you to see quickly the shoes. I'm so glad it's up. Oh. I'm old Thomas now. That's what they get called at home. And one more slide. There we go. And what does this picture mean to you about our work with the people? And the next slide is a picture of me and my family. I'm a little boy in this next photo, and I wanted to put it up as a reminder of your own beginnings. Our lives as workers are colored by our inheritance, by our past. Did we grow up 50 years ago, 30 years ago, 80 years ago? It makes a difference. Are we men or women, or are we gender fluid or gender neutral? Are we gay or straight or bi? Are we parents or are we not? Are we grandparents or are we not? Did we grow up in the city or did we grow up at home? Or did we grow up in rural areas? Did we have trauma when we were children? How did we do in school? All of those things color how we perceive the world. And certainly for me, that's exactly the case when I was a little boy, and I don't often tell people this because I don't like to be colored as someone who's suffered trauma. So I don't like to talk about my trauma, but I had as much trauma as anyone. And when I was a little boy, my sister was killed in an accident in the family yard. And I remember standing by the road and waiting for the ambulance, and the ambulance service was new. And we didn't quite know if the ambulance would come to our reservation. We just didn't know. And I remember standing there, it felt like forever. And by the time the ambulance came, my sister had passed away. She was 8. I was 5. And and it was such a formative experience, a very painful experience. It's no surprise to me that now I spend my time with communities preparing them for things like emergencies. Children getting hurt on the playground happens. It's actually kind of predictable. In all of your communities, in all of your playgrounds, there's probably been an injury, and probably we should be ready to respond to that when it happens. Next slide, please. And this is where I'm from. I'm under the blue lettering, it says British Columbia. Under that blue lettering is Salish homelands. There are Salish in the United States. We're what we call in Canada a trans-border nation. We have Salish on the northwest coast of Washington State and British Columbia. We're seafaring people. And we first had contact with white people starting in about 1792 with the arrival of a man named Captain Victoria and 2 Spanish ships. He was traveling with a couple of Spanish captains as well. And they actually visited my mother's village back in 1792. And what a ride it's been. What a ride it's been since that contact. Next slide. I like this representation of us and our nations. You'll see, pay attention particularly to the northern part of Canada. And you'll see, this is a figure showing population density of indigenous people, not population density, percentage of the population that is indigenous. You'll see in Alaska, 19% of the total population are indigenous peoples. In Canada, 25%, 50%, 85% across the Arctic Circle are indigenous people. We're the majority in these vast tracts of land. So immense power, political, economic power for my people in the northern part of the country. And it's a different kind of scenario there than maybe further south, to the nations further south. And I show this because I like indigenous realities. I don't like thinking of indigenous realities as being second class to dominant cultures. I like to think of them as being foremost in our minds and to remind us and ourselves that we live within indigenous realities as well as colonial realities. Next slide. This is Ayus. This is an island in my territory. If you cut it along its long spine, one half of the island is in our possession still. It's completely undeveloped, just forest and beach. There isn't even like a concrete pad on it or a tap. On the other half of the island are about 4,000 tiny pieces of real estate now in private ownership. And to me, it's a metaphor for the lives that we live, that we are partly in indigenous realities and partly in colonial realities, butted up against each other, often in a very uncomfortable way. And I think we saw and felt that a lot during COVID. And I think we see and feel that a lot just in everyday life, but particularly in health. So for instance, where's the water table here? How is the environment doing here on this island? If I was going to put a clinic here, where would it go? Are we going to share resources, or are we going to fight each other with hatred and violence? Will we be kindly, or will we be neighborly? The resources on this island are finite, and we have to organize ourselves to make sure that everyone has enough. And the rich live close to the poor. And there are workers here. What is their environment like? How is the school? What's the future like for the children who live here? Enough about the metaphor. But this island to me is very symbolic of the dual reality, of this foot in both worlds that we have. And my father, from when I was a little boy, was very clear about a foot in both worlds. He didn't pretend it was the olden days. He didn't try and forget or erase our beautiful past and inheritance. He said, you live in both, and we, above all else, are adaptable. Indigenous people are adaptable. So be masterful in straddling both sides of this island. So even as a little boy, and people would say, oh, you're good at school, you can read a book and remember, and really it was no talent. For me, it was like being short or short-sighted. It just happened. I could read a book and remember it. It was nothing. I was just born that way. But my cousins would make fun of me and say, oh, you're a sellout. Oh, what are you doing getting an A+ in English for? And I would never apologize because I could hear my dad's voice. that we stand in both worlds, so be excellent in both. Next slide. However, I think for many of us, certainly compared to when we were young, our ancestral knowledge or indigenous knowledges or the way that we grew up are starting to be welcomed so much more than yesteryear. We are so glad for instance, the beautiful cultural center that's nearby. Thank goodness it's there. What a beautiful, extraordinary investment, testament, show of power and might. That's an example to all of us. And I personally spend a lot of time gathering even the most insignificant bits of indigenous knowledge that I can. I'm thinking, for instance, my father used to make me do cold water baths. I had to bath in the river. All times of the year, even when there was snow on the ground, my father would make me go in the water. I thought my dad was crazy because I was a little boy. Who sends a little boy into freezing cold water into the middle of winter? I really thought he was crazy. But now I know, and he would say things like, "Did you die?" I thought he was so hard and callous. And my father didn't raise me with a gentle hand. My mother did. My father did not. He expected me to be tough and uncomplaining and to be able to sleep on the ground between logs with just a jacket. We would go and collect food, and I would have a jacket, matches, and a knife. And we would sleep on the ground between the logs in the middle of winter, and he would make me get up early in the morning, and we would be hunting and fishing and being quiet and being focused and carrying unbelievable weights, and I was a little boy. And he would say, that's our way. And I would see my cousins, and I would think, I want to sit on the couch and watch Gilligan's Island. I don't know what I'm doing. I don't know, my dad thinks it's like Iron Age. He thinks we're cavemen or something. We're out here, and now I'm so grateful that I had that. And my father was really tough. We had lots of white people administering our lives. And I remember one of the teachers saying to my dad, "You know, by law, your son is supposed to be in school." Because my father would take me out one day a week. One day a week. This was my father and mother both went to residential school. And my father didn't want me to not know our ways. So he would pull me out of school and we would go hunting and fishing. He didn't want me to not know where the salmon were. He didn't want me to be the only Indian in 1,000 generations to not know how to catch a fish. He thought that was foolish. But this teacher came at him one day and said, "You know, by law, your son has to be in school, right?" And my father said, "F you, tell me how to raise my children." Because we have literally something called ta'au. This is how you raise your children. You don't make it up as you go along. You actually have to learn how to raise children. And this is how it was done. And so he didn't really explain. He was screaming at her that, I am raising my son in the way he is supposed to be raised. And who are you to put your nose here? And I'm telling you that very purposefully. I'll come back to this. We go to the next slide. My great-grandfather, Atam, my last name is Adams. This is where my name comes from. He got smallpox in 1862. This is a picture of him taken in 1930 when he was admitted to hospital. He's alive. I know it's hard to tell. He's alive, but he's blind. Smallpox killed, at the time, about a third of the people that it infected. In fact, it killed a third of the people on the coast of British Columbia in 1860 from smallpox pandemic that started in San Francisco in 1860. He was blinded, but survived. And when I was growing up, I didn't know he had smallpox. All I knew was that he was blind, because his wife, my dad's grandmother, raised my dad So my dad's grandmother, who raised him, told him about her husband, my dad's great-grandfather, or grandfather, that he was blind and that he would go into the forest, he would cut wood as a blind woodcutter, handsaw, feeling around, cutting wood, and then his daughters would sell that firewood by the road for like next to nothing. But that was how he made a living. And now, as exhausted as I am, and as much as I felt sorry for myself, how hard I worked during COVID, I would remember him, and I would get up, and I would work. Next slide. And this next slide is the little girl, that's my grandmother. That's my dad's mother. And the man beside her is actually her older brother. Yeah, he's really a teenage boy. This is the only photograph that exists of my grandmother. When she was 15, she got pregnant with my dad. She had my dad, and then she died from tuberculosis. Communicable diseases were very real, and they very much shaped my family in that I knew that my father was an orphan. I knew that my father was raised by his old grandmother. I knew that he thought about her. He would mention his mother once in a while. In fact, recently my father passed, and he was saying to me, when I cross over, I'll meet my mother. I thought of her a lot when I was growing up. I thought, I'm lucky to be here. She was not erased as much as anyone didn't care about indigenous teenage pregnant women in the 1930s. I'm here. Her name was Losa. Next slide. This is my mother at the top of the frame, middle, residential school. My mother went to an Indian hospital from 5 years old to 7 years old, a TB hospital. My mother did not have TB. They sent her to a TB hospital. Her father, who had TB, who died when she was 10, was not sent to the TB hospital. From what my mother explains of what they did to her for 2 years, between the ages of 5 and 7, was medical experimentation. TB hospital. She did not have TB. When she was 7, my mother went to residential school. She stayed there until she was 18. And when she was 12, and my father was 16, my father was finally caught because my father was on the run with his grandmother. And his grandmother was, he said, was a very strong, fierce, honest woman. And when she said that she felt she would die without him, he believed her. So she didn't let him go. And so they went on the run in the bush, and they didn't catch him until he was 15. And then he went to residential school, and when he was 16, he met my mother. And they were together for 70 years until his passing in January. But in Canada, we have something called the Truth and Reconciliation Commission. We were collecting first-person accounts of residential school experiences. My mother would not talk to me. You all work in helping professions. Imagine being unable to get your own mother to talk about her trauma. How frustrating that is. I tried everything over decades. Please, tell me what happened so I can, even if I'm the only one who knows, even if you make me promise that what you tell me will die with me, even if you don't want your descendants to know what happened to you there, you know I can handle any of it. And she would not tell me. And I said, please, this Truth and Reconciliation Commission is collecting these first-person accounts for posterity, lest we forget. You can tell me. And she never did. But I know that when she came home after graduating from grade 12, my father asked her, because she came home and married my father and lived in my father's and his grandmother's house. And he asked her to make fish head soup my mom was 18 and she didn't know that when you cook a fish, you have to take the gills out of the fish. And so she boiled the fish with the gills in. And my great-grandmother was so disgusted, and she said, "Where did you find this woman? She's so dumb." And I think that's why my father was so fierce about me having indigenous knowledges. He didn't see the rationale for having it be erased or taken away from me. It's why he insisted. I'm telling you these stories for a reason. If we go to the next slide. My father's gone now. My parents did not tell their story to the National Archives. My mother's still alive, and part of the reason I need to go home is that we don't leave her alone since my father's passing. What happened to them happened to me. I'm the one who tells their story. I made a promise as an honorary witness to the Truth and Reconciliation Commission that I would tell the stories of residential schools. As horrible and painful as those stories are, how do you talk about the suffering of children to audiences without really bumming them out? And I had to learn. They actually monitored me. They said, "We've seen you present twice and you haven't talked about residential school." And I thought, our way is to be honest, to be authentic, to not tell you sweet things that are impossible to be true. I have to tell you the truth. And so, what happened to them, what happens to us, happens to us. What happens to our communities happens to us. All that suffering that we witnessed happened to us. COVID happened to us. The care that we give happened to us. And where we find ourselves now, and where our people find themselves, has happened to us. And so what is the story of us? Next slide. And I keep coming back to my father, because in my culture, we are supposed to talk about what's on our minds, to be honest. I could stand up here and read a script, but in a way, it's fake. My culture says I must speak from the heart, and my father's words are in my mind all the time as I get used to this absence and this presence at once. And for those of you, and I dare say probably some of you here have lost a parent as an adult, they're seeing them and hearing them is a part of our lives. And my father was fierce, a fierce warrior. He was a national level athlete. This is a best player trophy for soccer for the province of British Columbia. And I would play soccer. He was so disappointed. I was a very average soccer player, definitely not national level, really average. But he would say, you get in there and you do your best. It's not about, you don't give up because you're not, the top player on the team. But he said, don't let anyone cheat you, because we were the only indigenous team in the whole town. And some of the white boys were mean. Not very many. Most were fair. Once in a while, though, you'd meet one, racist, yelling in your face, swearing at you, trying to intimidate you, cheap-shotting you. And he would say, don't let anyone cheat you. Don't let anyone hurt you. Don't let anyone wrong you or your family. There will always be someone who will want to steal what you have. If you are rich in your heart or your mind or your spirit, that someone will see that and will come and try and steal that from you. It's inevitable, and you must be ready. And so he would say, not because I want you to protect yourself. I don't care if you get kicked in soccer. But it's because of something, and I'm paraphrasing, it's about karma. It's about the universe. You can't let a boy think that he can steal your dignity, that he can cheat, that he can bully, that he can scream and get his own way. You have to stand up for yourself. Do what is right for him and for you. And I hear him, because it was a constant in my head. for decades, and I'm asked constantly, what is the secret to your success? And I say, well, I grew up in Tao, our way. We go to the next slide. And really, to put it very simply, when I found this cartoon, I knew that was it. If we go to the next slide. Resilience is sometimes resistance. Don't tread on me. I will bite you. I don't know how to say that except in my father's way. And I think during COVID, I don't know about you, I actually haven't asked anyone this. I saw a lot of unfairness during COVID. I thought our communities were treated unfairly unless we were there to say, treat my people properly or else. I don't know how many times you were at the negotiating table saying, please help my people be well. COVID is amongst them. They need help, support. Vaccines are coming, vaccines are here. We need help to protect them, especially those most vulnerable. If we can go to the next slide, that'd be great. But that feeling of needing to fight once in a while persists in my mind. Sometimes I would wake up literally furious. I didn't get to ask my dad if that was normal. I did hear him say, don't give up, don't stop. Because I would say to him, I'm really tired. I can't do this for much longer. I've worked 80-hour weeks for 20 months. I have not seen my own children. I've not seen my parents. I've not seen my sisters and their children. I haven't been able to do auditions and to act as something that I love. All I've done is help look after the people. And he would say, don't give up. Next slide. And we are a part of, and this is a quote from one of the chiefs from one of the nations in the city of Vancouver, what's now the city of Vancouver in Canada. We will no longer be invisible in our own land. We will not be disregarded in our own land. I remember meeting with the chiefs in Vancouver and with the Dean of Medicine and the Dean of Medicine at our university saying, we really want to help Indigenous people. And the chief said, your university is in my territory. It would be nice if you did something helpful. That's how he spoke to the dean. Next slide. At one point, if you drew a circle, the medicine people were Aboriginal. The medicine was Aboriginal. Nurses, teachers were Aboriginal. But as colonization evolved and you looked at the circle, there were no Aboriginals. We were pushed out of our own care, pushed out of the care and protection of our own families, pushed out of the care of our own nations, pushed out of the circle of care, when we all know the circle of care, all of us here, has lots of brown faces. And so include yourself in the circle. Step into the circle, please. All of you, come back into the circle. I know we've all been sitting at home, but please step back. It's a beautiful circle. It's holy work. And you are so much needed and so very, very welcome. Next slide. I'm putting this up because I'm asked all the time, what's happening in Canada? It's instructive, and I get that because I come here to the US, your health system's different than ours, and I am grateful that you invited me here. I'm not a part of your system. You're the experts in your system. I'm not an expert in your system in any way. I go to Hawaii, and I learn by being in a slightly different environment. We're not biological cousins, but we have the same colonial histories. And so what's happening in Canada, and here's a listing of some very important publications in Canada. Maybe ignore the older ones and go for some of the newer ones, including the Royal Commission on Aboriginal Peoples, which is many thousands of pages, the Romano Report on Canadian Healthcare, Jordan's Principle, which has many extraordinary recommendations, the Truth and Reconciliation Commission, which looked at residential schools and has about 100 calls to action that are absolutely extraordinary, and the inquiry into missing and murdered Indigenous women and girls as a start. So those are seminal documents. And if I meet a dum-dum bureaucrat who has no idea how to work with our people, I say, go and read these reports and then we'll talk. Don't make me start from zero, because I'm really busy. And so those are some seminal works that can help. Let's go to the next slide, including looking into murdered and missing Indigenous women and girls and some of the actions that we can take to protect our women. I spent the early part of my clinical career in the downtown area of Vancouver. And any woman, about a quarter of the women in the downtown east side are Indigenous women. And any woman with substance use or mental health issues living in that area is so subjugated to violence, especially sexual violence. And we don't talk about this enough, there's a whole community of men who are invested in the disrespect, disregard, hunting, humiliation, undermining of women, especially Indigenous women. And often we look to those poor women to save themselves. What can we do to help you? When in fact the problem is these men who are so invested in degrading them. And having worked down there for 5 years, I will not take that back. Sorry, men who are feeling slightly sensitive. There are a few amongst you who are horrible people and horrible to women. We'll come back to them. I call them the bottom 10%. I don't know if it's 10%, but it's just to give you an idea. That disruptive group of men who are so hurtful to our women. And in fact, so much so that, I have many young nieces. When they go off to the cities, we make a plan so that they're protected, so that they're not exploited. We invest in young women who need to leave our homes, the safety of our homes, the beauty of our families, to go into cities so that they are protected from exploitation and degradation. Next slide. This is Joyce Echaquan. She was an Indigenous woman in the province of Quebec who was degraded, humiliated by work staff. She posted live to Facebook as she lay dying, and the vitriol that came from 2 workers at her, calling her down, being racist towards her as she lay dying, created a national uproar. And so if you get a chance to learn more about this case, Joyce Echaquan, I encourage you to do that. The next slide. In a more complete sense, there's this report, In Plain Sight, and this came out of my province, the province of British Columbia. It's called In Plain Sight, Addressing Indigenous-Specific Racism and Discrimination in BC Healthcare. It's a review of literature, correspondence and submissions involving more than 900 studies. More than 600 Indigenous people shared their experiences. Sorry, they weren't all Indigenous. Some of them were non-Indigenous healthcare workers who were working with Indigenous people who had experiences of racism along with their clients. And many of these cases were very disturbing and showed just how much our people suffer, just how much racism is bred into the system, and just how much work needs to be done. Sometimes this minimization of how racist and hurtful the system is not helpful. In fact, just last night, I heard from a reporter who was minimizing racism in the healthcare system, a white male reporter, minimizing racism in healthcare. And I had to say to him, big surprise, you're not a healthcare worker, you're white and male, you're not in the system. Of course you don't see racism in the healthcare system. I, who have been here for a very long time, know that racism exists. And your opinion is not the same as my knowledge. Thank you very much. Next slide. In British Columbia, we're trying to change the way that we practice. It's around cultural safety, cultural humility. It's around taking an anti-racist stance. I'll talk about anti-racism, but cultural humility is really accepting that we work from a particular place. So let's say I'm a doctor, I'm going in to see a patient, my patient is extremely sick, maybe she's not conscious, and maybe her family members are there. I want to speak to her, I want to examine her, and the family's saying, can you please just leave her be? She's sleeping, she's resting, she's really having a hard time. Could you show some compassion? Can you come back later? And humility is me saying, I'm not the most important person here. I have a job to do, but I will come back later. And to allow that family and that patient her quietness and her dignity, and to say, my view is only my view. My need to do my work is only my need to do my work. And maybe for the family, they have other concerns than me getting my work done. And that's all we're trying to do with this practice standard. I'll come back to it. Next slide. My province has also adopted a Declaration on the Rights of Indigenous Peoples Act. This act in my province enforces the duty to consult. The duty to consult is simply this. If decisions are being made about Indigenous people need to be in the room. If you want to come and mine in my territory, you have to come and speak to me if I'm the leader in this territory. It's very, very simple. It's called the duty to consult. It's related to the UN Declaration on the Rights of Indigenous People, and it's now enshrined in law in Canada, the country of Canada, but also in my province. So it affects the federal and provincial governments. Next slide. And so in this environment, we, in my province, are imagining a new kind of Indigenous public health. If we could put aside all of those rights-based issues and correct them and say equity and inclusion are important to us, what would we do? And so we asked the people, what do you want Indigenous public health to do? What do you want the health system to do for you? And we know that Indigenous people experience public health different than the general population. We know that we have the worst inequities of any ethnic group in the entire country. Indigenous people used to own everything, and now we own next to nothing, well, hardly anything. We come in last in almost every social determinant of health and every measure of socioeconomic status. And this is contrary to the popular opinion. I remember going toe-to-toe with a doctor who came up to me and said, you know, all that money you guys get for Indigenous health, you should give that to immigrants. And I thought, wow, she's really bold. A white woman coming and schooling me about Indigenous health. And I said, immigrants? Do you mean like you? Because I'm used to doctors saying, give us the money and we'll take care of the problems. And I thought that's what she meant. I thought she meant, give me your money. So I said, do you mean like you? And she said, no, not me. I mean immigrants who've been here for less than 6 months. I thought, oh, that's an interesting definition. And we went, hey there. Oh, great, thank you. So we went toe-to-toe, and all the other doctors in the room were acting like we were having a brawl, like a pub brawl, because they all jumped on us and pulled us apart. I thought we were speaking reasonably, but maybe we were screaming a little bit. But yeah, not today. I do not take being schooled in Indigenous health, unless it's from an elder or someone who I know has good knowledge. Let me see if I can change the slide now. Oh, I did. I just did it. Yay. So here are some very important, from our perspective in looking at Indigenous public health in British Columbia over many years, key considerations in Indigenous public health, key considerations in looking after our people. We must decolonize the system. We must decolonize our approaches. We must decolonize the way the system supports or doesn't support our people. Community and locale specific. What works in Michigan doesn't necessarily work in Seattle. What works by the ocean doesn't necessarily work in the mountains. What works in the north doesn't necessarily work in the south. Prevention and promotion versus being reactionary. How much of our work suffered while we reacted to COVID? Virtually all of it. I personally dropped hundreds of files. We're hearing now about those unattended cases, say, of cancer. Tumors were growing during COVID, and nobody was watching over them. We know our people want holistic approaches. We know that we want relationships with those in charge, not just being controlled or subjugated or dragged along, unconsulted. We'll get to you if you get in line. We'll deal with it if you're organized enough. Stories as evidence. We still, in spite of all of our work, we're still hearing stories about how our people are suffering. In spite of all of our investment, and really my organization has spent hundreds of millions of dollars trying to improve the health of our people, we're still hearing stories of people suffering, and we need to react. It's not that we're not doing our jobs, it's just that that's the terrain that we work in. Some themes that we see in looking after our loved ones in their communities, in our communities, that the colonial experience colors our health. Our health was going along in a particular way, and now we have health interrupted. Colonization interrupted the course of our lives and our well-being, and continues to interrupt our well-being. Of course, sometimes colonialism has given us some extraordinary tools, like painkillers. Oh, well, wait a minute, sorry, that was kind of a double-edged sword. Maternity wards. Oh, wait. Our women were policed when they were on those wards, and their children taken away at the drop of a hat. But that colonial experience within the healthcare system needs to be monitored. Well, first of all, we need to be aware of it, and then we need to examine it. We know that the social determinants of Indigenous health affect our lives. Things like health literacy changes a person's outcome, changes how much they suffer, changes how soon or late they die. We know that our environments are under pressure. They're under scourge. We know that the nation around us presses on our environments, seeking out our resources. We know that racism is alive and well. We need data. Without data, it's hard for us to see into our own houses. We need to be able to illuminate and look into our own homes and see what's going on. And of course, our leadership, our family heads have said our mental and emotional and spiritual well-being needs caring for. Somebody do something. And so in Canada, we've imagined a new approach to Indigenous public health. So if there's one thing that you get from today, please Google this report. If you just Google CPHO Indigenous, this report will come up. Oh, and there's my alarm saying I have 5 minutes. You'll find that report. So I'm going to skip a few slides then, because what I'm going to mention are related to that report around our environments, being stewards of our own environments, our personal stories of being in the environment, like being with my dad in a boat, being with my dad in clam digging, being with my dad and being sent into the water. Those are stories, and he would tell me when I was in those boats, so-and-so used to live over there, and so-and-so used to live over there. And those bits of knowledge are actually exceedingly important for me to catalog and to write down. There is so much sacred and holy within our territories, and we must know them. I remember my mentor in Hawaii saying to me, mainlanders come to Hawaii and they don't know this place. They never bother to get to know this beautiful paradise. And I always think I don't want to be that person. I don't want to be in my own homeland and not know my paradise. I need to know every stone and every bird, and I need to know how the water is changing, and I need to know the weather patterns, just like when I was a kid, and that was what my father demanded. And we need a view into our house with data, and that means data matching, not us taking over our own data. Yes, being stewards, but the lion's share of the data is held by the state and is held by the federal government. It's held by our partners. We must match to them. Most importantly about data is we must count ourselves in. We count. We matter. We're supposed to see ourselves in that data. Everybody hurry up and give me more data. Everybody include me in your data catchment. Of course, I want control over that. But all of you, and I don't mean you specifically, I just mean the whole world should be giving me data about our people's health. And we must continue in our efforts around mental health. We know that the opioid crisis is stealing far too many of our people, and I hope that we will spend a good amount of time talking about that here in this conference. And I'm going to skip the slides on the Truth and Reconciliation Commission because I have talked about them a little bit already. And pass very quickly over this painful subject in Canada. We're expecting to find at least 20,000 children's bodies in residential schools in Canada. 20,000 of our children lost and buried in graveyards outside residential schools. It's very sad. It's absolutely infuriating. It still makes me angry. I still face residential school minimizers and deniers, and that is part of the work, to not have those lives be erased, to try and bring those children's remains home, and it means ceremony, it means leadership, it means investment, it means data banks, it means biological sampling, it means the cooperation of villages and families, it means talking about children who are gone or maybe even long and forgotten, and maybe some detective work. It means dealing with the fury that we're feeling and the frustration and sadness. But those children are gone now, but we must not let them be erased. And that is part of the work in Canada, lest we forget what happened to us and to our children. So I hope that you see the way forward is as simple as turning towards what needs doing. Turning towards what needs doing. Waking up every day and remember sunrise. The sunrise is eternal. There will always be a tomorrow. There will always be another chance to do this work. Don't avert your eyes. I know you're tired. Don't be sad. It's okay. Keep your eyes open and look to the work and be courageous. And I dare say that this work that we're doing isn't all about our Western skills and knowledge. In fact, we probably need, I know we need to bring our great humanity, our authenticity, and the evolved personhood that was part of our youth, our elders saying to us, you must be a good, strong person in order to survive, but also to be a help to others. I also want to say that helping each other is extremely natural. It's actually very core work. Maybe it's as core as nutrition. We're built for it. My elders used to say, you're not a dog. Being a dog at home is not a bad thing. But the elders would say, you're not a dog, you're a human being. You have a voice. We talk to each other. It's what we do as human beings. And I always remember that. As much as I feel shy sometimes, I try and remember our way. And I know that I need to decolonize my approach. I know that I need to be humble. I know I need to be a good ally and I need to be anti-racist. But most importantly, and I am skipping ahead a little bit because I do want to end, I'm already 1 minute over time for the Q&A. I do want to remember one elder who was looking at me and he said, I know you're smart, but I want to see if you're strong. I want to see if you're strong in our way. Smart, I guess he was saying, didn't impress him much. Strong in our way, that's amazing. My slides are not advancing, I don't know why, but I hope that you will see the beauty of doing things in our way again, and not just see the Western way, not just see our hospitals and our clinical system, but see our elders and our traditional system of care. I hope you will see the love between us. I hope you will see the camaraderie between us. I hope you will see the fierceness and the strength in each other, not just how smart that we are. And I hope that you will remember the story of you and the story of us. I'm trying to get a handle on it, and I know that part of it is being home, not in my clinic. Part of that is being home with my family and my parents and my dad and his wisdom and the elders and doing things that my people think are important and not just being in the office or the clinic and doing what my colonial masters say are important for us to do. And I hope that today has been helpful to you. I'm remembering an elder of mine saying to me, I was trying to tell her how important I was in Emerge, and an old woman had asked me to go and get her some water. I said, can you imagine? I had so many difficult cases, and she made me go and get her water. And my elder said, oh, maybe she thought you were there to help. And that's what I want you to be. Continue to be great and wonderful helpers. Thank you very much. Thank you. Thank you, everyone. Oh, we're behind, so no Q&A.
All right, so we want to thank Dr. Evan Adams for all of your time, all of your amazing skill, and all of the things that you've been able to bring. I've been taking notes this whole time, just all the great things, and I'm just so thankful. And I just want to let you know that the stories about your parents will continue on. So thank you for taking time to be able to come and talk to us today and share all of your great wisdoms. And you've always been a big hero of mine. I remember whenever Smoke Signals came out, I got my shirt, and I was very thankful. And to even now, because all of the great things that you continue to do, and your message today was so powerful. So again, thank you so much. I do believe we have a small gesture for you. All righty, one more time for Dr. Evan Adams, please. All right, well, we're gonna keep moving on. Again, we wanna thank everyone for being able to make it out this morning. I know we've had a lot of folks come in, so please come in, make yourselves at home. We have rooms, we have some chairs up front, so please come to the front and make yourselves at home. But really quick, we're going to take a 10-minute break, so get a chance to check your email, do what you need to do. But whenever we come back, we'll have a quick Q&A with our other MC, and we'll get ready for our Indigenous chefs. So it is currently 10:51. We will be back at 11:01.